time it is part of the equation when we make decisions. You know, you can talk about the science and all for the first 20, 30 minutes with the patients, but in the end, it's that last 5 minutes that count. You know, so we're just sharing with the group.
They're stressing the importance of MDT, having all the specialists, the doctors, not only the surgeon and the oncologist, but the whole team, having a patient-centered approach. Dr. Kagiwa?
Yeah, I think we, as much as possible, we really do multidisciplinary management. But be that as it may, this patient was not given neoadjuvant with that quite advanced. But of course, in her setting, she would have been a candidate for CDK4/6 inhibitor and hormonal therapy. But it was quite prohibitive. The prices are really quite prohibitive. And of course, at the time, there was only, this was 2019, I think, right? There was no, how do you call this, support yet from some pharma regarding to bring down the price or to make it more accessible, to make it for patients and more affordable.
We have another session about locally advanced breast cancer, which Dr. Cheng Har and Dr. Rosita Malik will be talking about. So I hope our participants and our attendees will be able to attend that session as well. And going back to the hormone receptor expression, Dr. Brock and I were together in a meeting in Malaysia, and we were informally talking about what about those findings of having an ER negative and a PR positive disease? How do the pathologists look into this, and how do our medical oncologists treat these patients?
Yeah, I have 2 points to make about that. One is that the ER negative, PR positive does truly exist. It's very rare, but we do see them. Usually it will be a very low level of PR expression, and ER negative. The other thing I would also point out is you really, when you get those cases, you have to look at what PR antibody your laboratory is using. There are some PR antibodies out there that are a little bit too sensitive. They can score positive when they're not truly. They're really false positives. So it's actually very difficult to know, and if unless you're looking and unless you've got that expertise to know whether you're dealing with a false positive PR or not. And then, of course, added on to that, we don't actually know the biological significance of being ER negative and PR positive when it comes to response to therapy.
Jane, do you use Ki-67 at all when you usually see an ER negative, PR positive tumor?
No.
But tomorrow, Dr. Brock and I are doing a full hour on Ki-67 and HER2 low. So if you're interested in either of those topics, we will be discussing those in more detail.
Yeah,
Julie, you can pay me later for that.
I do realize I said monarchy earlier, and I actually meant the Destiny trial when I was talking about the, apologies for that.
Just change the case scenario a little bit. For example, if this patient also presented with asymptomatic brain metastasis. So this is one common scenario as well that we see, and medical oncologists quite struggling how to approach, of course, regardless of the hormone receptor status, HER2 status, but how soon or how urgent it is for radiation oncologists to provide treatment. Dr. Yap, would you answer that or give response to that?
Yeah, I think it's a difficult one. I think it really depends on the patient and the number of brain metastases, the location, whether or not any of these metastases are located somewhere that we're concerned about, and and also I guess what other treatments this patient has had and the overall prognosis. We'll always, if it was in our clinic, I would always see the patient. To see them, assess them, and discuss the options. And can be that we have stereotactic treatment available in our centre. So if there's in particular one lesion that's the largest and concerning regarding imminent symptoms, then it could be that we can treat that lesion first, or it could be that we continue to observe with MRI surveillance. I think it really depends on the number, the size, the location, and really case by case. But interested to hear what other colleagues are doing in this setting.
So at our center, and even in my training at MD Anderson, we were very aggressive. When the lesions were found, we treat them right away. And I think part of the thinking behind that is that a lot of the drugs don't penetrate the brain that well. If you find it, you want to just go ahead and treat it and move on. And our center tends to be very aggressive with the stereotactic radiosurgery, and we'll treat even up to 10, sometimes even more, with stereotactic radiosurgery to spare cognitive toxicity that you can get with whole brain radiation. So that has been our approach.
Even with symptomatic visceral metastasis.
With symptomatic, yes.
Visceral metastasis.
And even post-resection, we'll do stereotactic radiosurgery to the cavity, the surgical cavity.
Was your question, what if they had symptomatic liver metastases? Would you still, I wasn't sure I understood.
Did you say liver or
Or,
brain?
symptomatic lung metastasis where patient is having coughing and shortness of breath.
Yes, so in those scenarios, it depends on how large it is. If it's greater than 5 or 6 centimeters, we'll then do a little bit more of a fractionated treatment. But that's something that's smaller. You could give a high dose treatment that's going to be just a few fractions or a few treatments.
So in an ideal setting where you have access to TDXD, and Dr. Graylo presented that data on Destiny Breast 04, how would you sequence treatment for this patient? Dr. Lorenzo, Dr. Kagiwa, and Dr. Dizon may share.
Yeah, I would actually love the audience's opinion on this. I'm trying very hard to stick to the protocol that Destiny 04 provided. So I'm not using TDXD as my upfront treatment in metastatic disease. And I am using it before I feel I need to go to chemotherapy in the hormone positive context, or after one line in the triple negative context. What I'm struck with, and the struggle for me, is treating HER2-0. And I have, several patients, subjected them to multiple biopsies, trying to find HER2-1 plus. And I actually posed a question on Twitter about whether or not my colleagues on social media would ever use TDXD on HER2-0, and there's no consensus about it. Jane, you mentioned the DAISY trial out there. Having looked at the data, it doesn't seem that promising if something is actually HER2-0 compared to HER2-1. But I think what you mentioned
Thank you,
is the
Wisdom Vista.
absolute
Thank
next
you,
step in doing HER2-0 versus 1.
Speaks,
Yeah,
Vista.
and I would
Thank
just
you
say,
so
if you
much,
want to get a,
Thank
if you want to get a
so
1+
much.
stain, ask your
Vista,
pathologist to use the
no
Sept test
crystal
antibody,
layer.
and you'll get a
Big
1+
loud
out of it.
shout-out.
I even went as far as
RMC
sending the
Blast,
path a second opinion to
kamusta
Boston.
sa Japan?
Oh, you wouldn't get one out of us. We use
Yeah.
a very clean antibody, so we have very few 1+s. We
Ay,
actually, it's actually,
late ako
yeah.
sa
But you can
symposium, kaya
create a
type ko
positive
na.
result very
Because
easily.
I've heard it from pathology that
Open to
there is
public
some
anyway.
expression, in breast
Especially to
cancers
ladies.
for HER2.
Well, if you think about it, I mean,
First
we
time
know
that,
from, there's
we
one
hosted
published study
the
looking at protein,
Philippines
quantitative
seminar,
protein
this
levels to
symposium.
try and
Last year, last
separate out the very low
20,
levels
I
of
think,
expression of HER2 protein.
it's in
And I think it was 67% of all cases tested fell into a detectable level of protein
Pasensya na
on the
kayo,
cell membrane,
pasensya na kayo
but that fell below the amplified cases. So, and an awful lot of those were HER2 negative by immunohistochemistry. It's just not the right assay. The assay is just not sensitive enough.
technical lang or medical term lang.
What is important as well is to educate our patients that whenever they experience disease recurrence or disease progression, is the importance of rebiopsy, right? Because the treatment will be different
Katutubo,
from-
thank you.
if we will base the treatment
Yana,
from
salamat
the original
yan.
breast panel that was done on the primary tumor.
And
And perhaps Jane, you can share more about your experience on the heterogeneity and the differences in the breast markers on the primary tumor and on the metastatic lesions.
Gaining HER2 expression is not particularly common. It's you're more likely to, if you in the neoadjuvant setting, we're more likely to see a loss of HER2, but even that is not that common. It's, the statistics, I think they're around about 10% change, but it's really not common that we see a change between the primary and the metastasis with HER2. We absolutely see a loss of ER expression, particularly now with the patients getting SERMs. It downregulates the ER, so you have an ER positive tumor, and they very commonly become ER negative, after a year or two of treatment. And again, I think Dr. Grella could probably comment more on that.
And the development of mutations in the estrogen receptor gene that may have implications for resistance, particularly to aromatase inhibitors. But there are many things that can change, and it's not just the ER or the HER2. And I think getting genomic profiling and retesting, now I want to do PD-L1 testing if they're triple negative. I want to know about PIK3CA if their tumors ER positive. But I also, we've got these blanket approvals if you have microsatellite instability or a high tumor mutational burden for immune checkpoint inhibitors. Sometimes I can see somatic mutations in, for example, BRCA1 and BRCA2, where we've got at least some data that suggests the PARP inhibitors that work with inherited mutations might also work if the tumors developed a somatic mutation. So, and there are many other things that there might be implications for therapy and that can change over time. Now, ideally, breast cancer isn't like lung cancer, for example, where you can get a liquid biopsy and look for some of these changes easily. Especially a breast cancer that's predominantly in the bones and that's ER positive and it's not very aggressive, you're going to have a hard time finding it in the blood. As opposed to maybe a more aggressive triple negative that's in the liver, you can do a liquid biopsy and just, find some circulating tumor DNA. Lung cancer, you frequently can find it in the blood. So I think we've got to make biopsies easier too and more reproducible. And then we'll have the opportunity to check more often over the course of treatment.
Stressing also the importance, as what Dr. Grelo highlighted, that personalized treatment is something that's very, very important for patients to understand that breast cancers are not the same, they are different. And the oncologists and the clinicians base their treatments on how the disease is behaving, not only on patient factors, but also on tumor factors. So these are very important information that patients should understand, that it's quite frustrating for some because they don't have the patience of doing these tests, especially in developing countries where you don't, doing NGS or all those panel are not reimbursed. So you tend to limit what are the specific tests where there is an available drug. For example, if there is a mutation that can be discovered, so the other panel cannot be tested just because, or perhaps the drug may be available, but the access due to cost may be too expensive for a patient to sustain all the treatment cycles. So these are the limitations, and these are the real thing that's happening in the Philippines and in other low and middle income countries. Dr. Brock, you're about to say something? Dr. Kagiwa.
Professor Gao, you mentioned that 55% of metastatic breast cancer is HER2 low. Is that really the statistics? Wow, that's more than half. Okay. Yeah, if that's the case, we have this drug now, but I'm sure it's going to be very expensive and or no one maybe can afford it here very, very few can afford it here in the Philippines. So, and of course that also, if you're saying that pathology is important because the antibody the HER2 testing is crucial, whether it's HER2 low, the +1 or +2. So does that mean that we have to retest some of our patients? And then if they can be eligible to get the drug?
That's why I keep biopsying some people. But it's really important you have a good relationship with your pathologist because they are very aware of this data as much as we are. And, if you are, I'm actually pushing our pathologists now. We do have a metastatic breast tumor board where we are not, accepting, oh, it's HER2 negative. We're actually saying, was there any HER2 expression at all? I think it's a really important thing to have that relationship with pathology. But I think the second thing, and Julie mentioned this, it's not a benign drug. So, it's been surprising when we talk at our metastatic tumor board about using TDXD, some of the reluctance comes from the oncologist because the interstitial lung disease is a real toxicity signal, and if you look at how the label ended up being constructed, the first sign of toxicity, you have to stop the drug. People with more experience with this will tell you can actually do steroids, you can watch it and prevent it from going to a grade 4 or 5 that's going to kill this person. But I think that there is reluctance from medical oncologists in the US of using TDXD.
Right, and unfortunately, when we first started using it, COVID hit shortly thereafter, and so there was this concern if you had a little bit of a cough or a little bit of a chest x-ray finding, is it the drug or is it COVID or what? So it was a bad timing in terms of when it got approved for the HER2 positive. I would say at this point, if you are certain that there's no way to get your patient access to this drug, then you should not be worrying about the HER2 low, right? I will also say that this is a perfect example of a drug that would not make it onto the WHO essential medicines list solely because of cost. It meets the 6-month prolongation in survival. It would meet the other criteria, but it would be cost. And this is exactly the kind of drug that we hope to include in our ATOM coalition, our access to oncology medicines, because it would be on the WHO's essential medicines list if not for the cost. And so that means we need to partner with the company, AstraZeneca, see if this is 50% of metastatic breast cancer is a huge number of people in the world. Based on this new potential market, can we bring the price down, or can we do, at least in low and low middle income countries, some kind of, this is our example of the voluntary licensing in the medicine patent pool, where we could get access for the low and low middle income countries to a drug like this that would otherwise meet the criteria for the WHO's essential medicines list if it weren't for the cost. This is an important drug. It has a real survival benefit, and we've got to figure out strategies to make it available.
So just to add to the discussion about the toxicity with TDXD, a lot of these patients will need radiation to palliate symptoms. And so one of the questions that we have is, how do you interlace the radiation with something that can cause interstitial lung disease? When you give radiation to the lung, you can also cause pneumonitis. So are you going to make things worse for the patient by combining those two agents together? So I'm working with a medical oncologist at our institution to help and try and look at that question. Can you combine those two treatments together safely and effectively for patients like this?
And I clearly remember when the data on Destiny Breast 04 was presented at the ASCO plenary, after Dr. Modi finished the presentation, there was a standing ovation. So you can see how the impact of this new drug made to a lot of patients, especially in the US, So, but we are very much looking forward to have the drug available in our patients in Southeast Asia. Any other words, Dr.
Well, I was going to
Diego?
say, do you know what the only other standing ovation I've ever seen at ASCO was? It was the adjuvant trastuzumab presentations, which overspilled into 2 rooms worth of people. So, and I think the reason it got a standing ovation, it wasn't just the drug, it was a total reclassification of pathology, and we've created a new category of breast cancer that we never had before either. You know, so it was the combination of both.
So everybody will agree that this is a wonderful discussion. We thank our speakers, our reactors, and Dr. Yap. Thank you for joining virtually. So we have so many information and thoughts from this session. And we hope to see you tomorrow for another interesting discussions and sessions. Thank you very much.
I know. It was like 2 hours went fast because it was interesting. So
tomorrow. We would like to thank our organizational partners, Global Focus on Cancer, American Society of Clinical Oncology, Philippine College of Surgeons, UICC Global Cancer Control, ABC Global Alliance, Philippine Society of Breast Surgeons, Philippine Society of Medical Oncology, Philippine Society of Oncologists, Swanbuk Breast Cancer Network, Cancer Coalition Philippines, Yayasan Kanker Payudara Indonesia, Shwe Yong Min Si Cancer Foundation, and Reach to Recovery International. We'd also like to extend our deepest appreciation to the following sponsors: Pfizer, Roche, AIA Philippines, Novartis, the Guzman Group, NutriAsia, Unilab, In the Pink, Healthway, and Glow. Thank you so much to all of our attendees once again. We are happy to see you here today. Please don't forget to share your SEABCS 2022 experiences on your social media and use the hashtags. Hashtag Better Future for Breast Cancer. Hashtag SEABCS 2022. Hashtag SEABCS Philippines. And hashtag SEABCS Manila.
Thank you, Pete. Thank you, Kuya Pete. Thank you so much, guys, sa mga nandiyan sa baba. And thank you for sharing also. Thank you, Kiss. Thank you to all of you, yung mga dumaan. Official Wang, di ako makapunta sa isang sinishare mo, later on. Later. Nag-comment ba ako? Thank you. Thank you for connecting. Ubi TV vlog. Mega loud shout out. Mega Mega loud shout out, Ruby. Dito lang ha, hindi pa naman tapos. So, dito lang ha guys. Thank you. Calming, music, mega loud shout out, please post. Drop your link please. Very short live lang tayo guys. Actually, na-late pa ako. So, late na talaga. Calming is, okay, this is your of course, nandyan kanina si Abuse Dambistack guys. Listening lang, nasa work. HB is 15.8 ang bahay niya. Napakalaki. Inggit much? Hindi. Dito inggit much. Ayan. Panoorin natin tong short video niya. Panic. Uy! Ang galing naman ito. Ikaw na talaga. Ano na lahat? Yahoo! Ayan, guys, mag-post lang kayo ng mag-post ng short video, guys. Official Wang, lagyan mo ng hashtag na short or short, tapos short. Ganyan. Para mapunta sa short, para maano ni YouTube, maikot niya. HB, ang galing-galing naman ng mga ano natin. Hugot, hello host, nag-share lang ako. Si Ruben, andyan si Official Wang. Sino nga to? Abuse Dambistack. Uy, nawala ka na, Abuse Dambistack. Ilang host, sige lang. Thank you, Yok, for connecting, Yok. Thank you so much. Please connect also with Abuse Dambistack. Please like and share, please. We are a short live lang. Rowang, gawas diha. O nga, gawas diha. O, lumabas na daw. Nasa isang LS siya. May sinishare siya kanina eh. Di ay lumabas niyan. Ganda ni Ruby. Ruby TV, you are so pretty. Itumba na kita. Hehehe. Insecure sa maganda. Sir Arnold, mega loud shout out. Nasa training lang. Rainy afternoon. Oo nga, muulan nga po. Lalo sa Baguio, no? Ay. Thank you sa patamsak. Biglaan ko lang to na as in wala sa plano eh. Biglang nag-share. Sayang. Sana kanina pa. Tomorrow na lang, i-on ko na lang. I mean, if you're not interested, okay lang din dahil nandun lang yun sa YouTube ko. Balang araw mapapanood naman natin. Yung mga pasaway sa Baguio. Sir, tip on uploading short videos kahit walang edit, diretso lang sir sa Baguio. Nako, patok yan. Lagyan nyo lang ng hashtag short or short and shorts. Guys, may nakapin tayo guys ha. Sir Philip, Sir. Hoy, thank tip dito lang sa gilid boss. Nagkakatigaw lang. Ay, hindi naman ako magtatagal kasi sobrang late din ako sa training. Tapos, salamat sa pag-tip. Yes! Oo, kaya lumaki yung views ko dahil naka 1 million ilang buwan lang dahil sa sobrang mga views. Pero ngayon hindi na ako favorite. By the way, hindi na ako favorite ni Hindi na ako favorite ni YouTube. Hindi na niya ako pini-favorite. Balas siya, no? Did I pin you already, Yok? Unicorn, yuhu, yuhu, yeah. Thank you. Andyan si Sir Pip, Pip. Ayan. Ayan na, wala na tayong sound. Wait lang. Wait lang, guys. Wala nang sound si host. Ayan lang. Mabilis lang tayo, ha? Mabilis. Dali lang po. Diyan lang kayo. Hindi ako ready na mag-live eh. Biglaan lang. Kuya Pip, ngayon ka pa naman pumasok, no? Tapos hindi ako ready. Calming. Wait lang. Mabilisan lang tayo, guys. Talagang mabilisan nito. Sir Arnold, thank you ha. Sige, upload lang ng upload. Tama yung nakapatayo po yung camera nyo dapat. Mag-upload. Yan, punta tayo sa Baguio, guys. Sir Arnold tayo. Miss Edeline, nasa training ako. Naisipan ko lang i-live, sayang eh. Ay, hindi naman sayang, pero supposedly informative because dapat yun yung isi-share ko. Na-late ako. Hugot tuladan na sa litiyo. Hugot is an ayok is a foreigner, guys, ha. Alin ang magandang ending host. Kuya Pip, sa susunod ha, magpa-spatial tayo, pa-concert tayo dito. Ayun, hindi ko pa nakiklik ang membership ko sa'yo. Wala ka bang premiere? Ayun guys, connect lang with each other. Malapit na tayo mag-end. Nag-end agad. Yes, sir. Nag-end na sa Germany, paligid ng puno. Yan, si Kugot PS, si Ruben po siya. Ay, si Ruel, guys. Ano bang i-flex natin? 2 weeks na. Ka na lang. Akala ko ikaw ay akin. Akala akin ka na lang. Akin ka na lang. Super late ako. Sorry. Or pa ako guys. Next time, pag nag-sing ng mag-aga, walwal tayo. Sige. Schedule natin. Gusto ko si Yana. Si Yana lang magaling mag-post. Connect to Google PH also. One of my friends, ang aking mga ninong talaga, no? Ano ba si Mr. Wang? Mr. Wang, nasa isang live ka na. Official Wang, and kapag of course, hanggang si Edwin Official. Ito ginagawa ko siya. Hindi na ako favorite ni Miss hindi na pinapanood yung mga universe ko. Kasi siguro sabi niya, paulit-ulit na nung pinapost mo ah. Ay, ba si YouTube? Hindi na ako favorite. Yan ah, hindi na ako favorite. Yan. Okay na lang din sa akin. At least may 2,000 views ako a day sa sino talaga. Good to meet you guys. Balik muna tayo kay Hugot bago mag-value tayo. Mabilis na ako sis. Mabilis lang. Natapos na kasi training. Bago ko pa naisip. Patapos na. Thank you for connecting with Hugot. Si ano yan? Hugot is his friend. Mr. Unsang Cupcake is in the house. May galaw shout out, Mr. Unsang. Mabilisan lang ako, Sir Unsang. Training kasi kanina. Safe naman ako. O, diba? Ayos naman ako. Connect also with Mr. Pip. TV official guys. Pakunik. Para si Sir Lennox to, sobrang ganda ng boses. Sana all maganda ang boses. Diba, ang dami. You know, look beside me. Alam ko, Sir Pete, pag mga ganito, pag-usa, mataas naman. Views. Huwag na lang mo nung alisin pag walang views, okay lang yan. After how many days, gago kung talagang hindi pinanood. Ayun o, super cute. Mr. Usang Cupcake need a mental health shout out. Bigla kasi akong nagla. Sam, how are you doing, Sam? And Rizal was here a while ago. Of course, I know, I understand you guys that you're gonna stay in one live stream. Provided if you're in a game or if you are having a game. Well, Spider-Man. Oh, galing naman ng short video mo. Mr. Unsang Cupcake, maglagay ka ng hashtag para ano, may hashtag naman pala. Na-view ko na to yung Spider-Man mo. Ako naman yung short ko kanina, sa kagal nito din. I am not the favorite also. I am no more the favorite. I am no more the favorite. Connect tayo guys, punta tayo sa Baguio kay Mr. Arnold Steve. Thank you. Galing na may photo booth yung aking seminar, kaya yan lang. Sayang, super late ako. Sayang. Na-share ko sa... Thank you for connecting with HB. Pinalaglab ko yung short mo. Diba? Hindi natin akalain magkakaganon. Sobrang laki ng views. Winner ka talaga, HB. Salamat po, HB, sa pakulay. Mag-PM ako sa'yo. Marami akong tanong. Hugot ko lang, wala medyo matake ang hinay. Kaya may konti mo. O, may ako din, sa Alikabok yan, no? Ulit tayo din sa ating admin, Edeline Official. Gimmick yan dito si Agoy, good tip. Pero maganda pa rin boses niya kahit ganyan. Kahit kunwari lang yan. Get ka nga, kanta ka muna. Hindi kita mainit dito, dating dikit kay Edwin. Okay, kasi ano yan. You're well, nandiyan sa ating survivor team. Sensitive sa dust at sa kahit ano. Pareho tayo, kahit sa public conditioner. Alikabok pa naman ng bahay ko, hindi ako nakakatingin. Oy, naku, okay. Mr. Unsang Cupcakes. Ayan, meron tayo nakapin. Si Mr. Unsang Cupcakes, guys. Tunit ko, kita niyo tayo gumagawa talaga ng mga cupcakes. Yan. Pasensya na kayo, alilima lang naman tayo. Ruby TV. Ayan, sis Ruby, sinaba ako bahay mo kanina. Yok, how are you doing, Yok? Yok is a monetized channel, a content creator, and a live streamer also from other countries, a foreigner friend. Crystal there. Crystal, are you still there, Crystal? Hindi kita na. Nanay pala sila Henry Sosa yan. Siya, isang cupcake. Ayan, tinititan ka ng foreigner friend natin. Hindi na kasi tayo. Ito pa yung mga bahay ng members, kaya na kasi. Alam ko, sa agapay, may nag-prayer. Maya na ako. Let's go daw. Na daw, let's go. Hope na pray that you will be. Mainit na kayo dyan. Mainit na kayo. Wait lang, guys. Init na is the key. Wait lang. Isang live lang ako, guys. Hindi tayo nagmamay. Sorry, balik trabaho pa tayo. May nagpipremiere pala. HB, may nagpipremiere palang book natin. Dahil na si Arnold. Sir Arnold, sinabayan tayo. Pinoy Golfer TV, mega loud shout out. How are you doing? Ba't wala kang jacket? Yeah, I'm at the short life lang, Pinoy. Yes. Biglaan ito. Bigla ang pangyayari. May matending at so, may natapos na dito like 15 days. Patak din si Ruby. Perfect na premiere din ako pag-sabi. Ang kulit ko lang, pati channel ko talagang talagang pre-promote ko na rin yung channel ko. Your channel, my channel, and your channel. Ba't di ko nilang nag-love ni Lolo? Sumirap na. Lolo, maawa ka. Laglabin mo naman ang mga figure ko, ang mga short video ko. Wala pa pala akong sorry. Wala pa pala akong harang. Nabilisan nga, wala pang harang. Yan mo na lang. Importante nakapag-live ng content. Kung may live siya, na-speaks na ba yan? No? Sabi na anak mo dito siya. Del, andyan ka pa, Del? Del, are you still there? El Caranto, are you still there? Yes. Ano na ba? Bigla ah. Yan, nag-prepare siya. Today is 23. Tapos na. Guys, sana ako sa bahay ng members natin at play tayo. Habang ongoing guys, habang selfie, nag-music ako. Sana hindi ako copyright. Sabi nila ang copyright yung page na nila. Wala kang harang ko. So, wala kang harang. Kasi biglaan eh. Kayaan mo na. Nilagyan ko na. Pero okay lang. Ayaw niya magpaharang. Lang Pinoy Golfer na. Wait lang. Kamusta po Pinoy Golfer? How are you doing? Kamusta ang channel mo? Ano lang? Ito na naman ako. Basta mag-post ka lang ng mag-post ng mga short video dyan. Sige nila lang hashtag your life. Hashtag short video, ganyan. Shorts. Hashtag shorts. Yo, thank you so much, Yo, for connecting with my friend. Of course, this connect also to Pinoy Golfer, guys. A good friend. Way back. How are you doing? Kasi ka po ba uwi sa Manila? Bakit yung sabi ng trabaho? Buhay o yung trabaho lang ng trabaho? Sana all, may diba? Magiging jobless na ako next month. Ay, next year guys. Baka na baka naman. O naka-live din pala si Hindi disqualified. Oh, ayan, can I vote for just renew my membership? Dali lang pinag-gold for ha. Sorry, ako umabot sa training. Ay, sa Symposium. Pinoy Golfer tayo, guys. Wait lang. Bakit i-slide ang transaction ko sa iyo? Pinoy Golfer. Sabihin, wait lang. Ang pangalan si Coachikas natin. Hindi ako mag-member sa copyright ko. Ayaw niya. Okay, ayaw niya. Tumagap ng bariya. You know, congrats naman. Pinoy Golfer, thank you so much po. Yan, I'm one of your golfer. Daan lang ako kapatid. Ayan, nag-member na ako sa'yo ulit. Nag-renew na ako at Pinoy. Palablag din sa itong bahay mo. Mayroon namang kay Kuya Pip pa pala. Wait lang, Kuya Pip. Pipip natin. Kay Mr. Arnold. Yan. Pakulit, please. Thank you so much. Sorry ha, na-late ako, tapos nawala na yung training. Nawala na yung training, tapos na. Sayang. Hindi ako umabot. Sana si Mr. Wang. Mr. Wang, are you there? Sana si Yana speaks. Yana. Yana speaks. Alam natin si Yana speaks. Tapos channel ko, Yana speaks. Ang dami channel. Makaingit. Sa 24 pa pala. Bukas pa pala kayo magkakantahan, Kuya Pip, no? Wala na yung atin. Yana, wait lang, Yana. Yana, speak. Yana, wait lang. Ang dami mong channel. Ito po yung video. Charles, thank you so much sa pag-training. Grabe nakita mo. Ikaw talaga bata ka. You please to Charles all vlog. Madali ako Charles kasi alam Symposium ako eh. Isang live lang sa ay tapos sila. Nangalamang tapos ito 15 minutes na. Ang labig ko pala. Guys, connect also to Charles. Dami din naman Charles. French chicken. Ayan, nausap na tayo, be. Share. Thank you, Charles, Charles Wall Vlog. Thank you so much sa pa-review dyan. Thank you so much sa membership ako, Bright. Ako na lang maging membership. Para i-training. Sinampay ako, sorry. Sinampay ako. So, you're doing this spouse in the house. Minsan sa pagka ko, hindi ako nag-step na nito. Hindi kahit pa lang share on. Yeah. Huwag lang ng post, dadaan natin kahit dadaanan din mga channel natin balang araw. Pag mawala tayo ng pag-asa. Thank you sa mga nandiyan. Are you still there, yo? Please connect with Diana or are you connected with Diana already? Okay. Mon Jamil, kamusta? Mon Jamil, alam na sis. Kamusta na? Kaya nandiyan si HP, nakikinig. Ayan, a live streamer. Ayan si Mon Jamil, na Javi, GBG lang. Okay lang, no problem with me. 1 hour lang to, guys. 1 hour lang para hindi ko kayo maabala dyan. Mabilisan lang. Mabilisan lang po. Kasi ang purpose sana is to share the training, pero na-late ako. Balik po na lang. Ayan, alam na this. Nakita ka na ulit. Alam na this. Mon, andyan si HB. Thank you, Mon. Kainis kayo. Ganun mo. Makita. Hindi ako kasi nagla-live. Nagla-live ako pag morning. Pasupong-supong lang. Nag-schedule na ako. Tapos ko na naman. Before this. Ayan. Wait lang. Baba ko tong premiere mo. Baba ko lang premiere mo. Salamat po. Salamat sa pakulay. Nahimik na nga ako eh. My support. Hindi naman siya pwede eh. O ano yung framework eh. Meron tayong sa trainer din yung isang member natin, guys. Support. But let's go muna to si kasi Pinoy Golfer, kanina nandyan si Yana, at of course si Charles to all vlog, ayan. And of course, I'm new member natin, I see Mon. Kaibigan nakabalik na ulit sa bahay. Tagal ko rin pag nawala. Pero mag-gamer ka eh. Nakikita ko mayroon sa mga eh. Baka gusto mo akong bigyan yan pang premiere ko. Saan na kaya si si Miao? Or no yung membership ko kaya gina niyo ako. Hindi na kami nakikita. Guys, yung new member ko, si Charles, kanina lang din ang inyo. And of course, we have Mon. Nagsalita ba? Okay na ba? Nagsalita ko naman. Nakita nag-premiere na naglagay ko na. Hindi nakita doon. Ay, hindi na pala ako saan. Diyan sila, andyan si Bukot, Ogat-Page. Andyan si Charles to all vlogs, that's me. Alright. Baka gusto mo akong bigyan ng pang-premium ko ng mga pang-gaming na ganito. HP, nag-boot, mag-consult ako sa'yo ha. Ayan, Simon. Ano po, nagpahinga ka rin sa nagpahinga ng konti. Hindi ka rin masyado sa app. Simon, huwag mo ayan, nagdami din na lang ang short. Mali. Dami din palang short video. Makakuha nga dito ng pang-short ko saan. Pag yung various content din yun, kaya kumuha ko pang-short video mo dito sa'yo. Kulit lang no? Yan Yan matataas din yung views mo, di ba? Keep on uploading short videos lang. Guys, may nakapin tayo, si Charles, and then of course, ang bagong member natin, dahil pumunta na sa Metro Manila, at tayo magtatagal. Pwede naman po. Hindi, makikita ni YouTube na reuse content, no? Hindi na nga ako masyadong ay mga, kahapon ako, magyayabang ako ba? I have 1.3 million already views. Your subscriber ba din pa rin naman? Mayabang lang. Grabe pala sila yan. Instacar, sila ako grabe. Mga 5 mga naon. Hindi maabot din natin. month. Last month kasi, parang favorite ako din. So, nasa i-post ko talaga ako malalaki. Siguro na-inis na siya. Sabi ko, parang hindi na lang i-post. So, naka-live si Super Mommy. Super Mommy, naka-live na pala. Sino nag-ano? Wala ko mapunta doon. Hindi, agad na lang. Ay, Super Mommy, naka-live ka, naka-ano ka pala. Ay, sabi na nakapin tayo pa ng vlog. Malaglag ng kanyang frequency. For days na kasi ako nag-start eh. Doon muna ako. Sige, doon ka muna. Punta ko doon. Tatang sa kami. Go, go, go. Ikaw ba mag-post doon? Parang ako doon. Parang magalik ako. Ikaw ba mag-punta na yun? Ikaw punta rin ako doon. Nandun ako. Nandun ako sa kabila. Wait lang. Hindi lang guys na nagpunta ako sa kabila. Ayan. Pasensya na. Pasensya na. Dito na balik na ako. Hoy, SEABCS, please connect with Mon. Mon, pakibalikan yung foreigner. Very generous din yan, parang kayo lang yan. Mon, pakibalikan. Let's go to Mon. Of course, to SEC, how are you doing? How's your channel going on? Thank you so much for dropping by in the live stream. I really appreciate it, guys. How are you doing? Joby Dunan, yung what data sa'yo si Yok. Thank you so much. Wait for me. Okay, wait for you. Nandun lang ako sa kabilang bahay, guys. Ano ako ng Love, naka-mont. It's love, mont. Thank you. It's uploading. Oy, Charles, upload lang ng short video. Ayan. Joby, Donan, mega loud shout out. Now that, generous siya, Jo. Very generous, sorry, ang font. Very generous lang. Nakilala ko lang sa isang live stream yan. Hindi naman na umalis. Palagi na lang kami nakikita. Joby, Donan, this is your, kaninang ninja ito. This is your ninja account. Mega loud shout out sa'yo. Didikitan ko na lang para magkaroon ka ng call. Pag magkaroon ng 6 na. Okay, thank you, Joby. Salamat. May nakapin tayo, please. Thank you. Of course, we have a friend. Korean friend. You're a Korean friend like SEC. Mr. Arnold is still in the house. Make a loud shout out, Sir Arnold. Ayan, in about a few minutes, guys, tapos naman, tayo makaschedule. Thank you sa inyo na nandiyan. Mga bigla-bigla ang ganito eh. It's ready guys. Thank you for staying guys. Thank you for connecting to each other. Meron ka bang upcoming? Kakapi ka pa rin ba o paikot-ikot ka dyan? Wala pa naman upcoming o tamad din match. Tayo mag-member pag may upcoming ka, puntahan natin. Tayo kunyari sikat tayo, di ba meron? Joke lang. Thank you. Salamat sa inyo na nandyan. Mega loud shout out everyone. Robbie TV, thank you for staying. Guys, kasi wala namang tao or I cannot really comment yung mga members kasi hindi ako ready. So, I just really would like to thank you guys for coming over. Thank you so much na despite na walang notice, dumaan naman kayo ng dumaan naman. Maraming salamat sa inyo na nandiyan sa lahat. Maraming salamat sa inyo lahat. Thank you so much for your love and support, guys. Thank you very much. This is Maldi Batubino, guys. We are signing off na. Thank you very much. Bye, guys. Diba, dalawang screen na. there? My foreigner friend, are you still there? Of course, Yok is still there. Thank you so much, Yok. HB, salamat. Salamat talaga. Kahit na ako din ganyan, di ba, HB, buti lang yung mga bait ng mga members ng HB nagpapareflect yung silang nakaon. This is Meldy Baldubi. Magtaming off na talaga. Maraming salamat. I will not take your time already. I know everybody is busy and kailangan yung ikot. Especially pag sa sobrang daming member natin na kailangan natin supportahan. Maraming salamat. Back to work muna ako, guys. Bye!